health officials from the Trump administration announced new rules on Thursday intended to end gender-related care for minors at hospitals across the country. One of the orders threatens to pull funding from any hospital that provided gender treatments for minors.
The first prohibits doctors and hospitals from receiving federal Medicaid reimbursement for gender care provided to transgender patients younger than age 18. The second blocks all Medicaid and Medicare funding for any services at hospitals that provide pediatric, quote-unquote, gender-affirming care. If finalized, the new rules would shut down hospitals that fail to comply.
Here were Health and Human Services Secretary Robert F. Kennedy Jr. and Medicare and Medicaid leader Dr. Mehmet Oz speaking yesterday.
So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice. We're done with junk science driven by ideological pursuits, not the well-being of children.
We want our hospitals returning to healing, not harming the patients entrusted with their care, or they're going to pay a very steep price.
The American Academy of Pediatrics pushed back against the administration. AAP President Dr. Susan J. Cressley said, "These policies and proposals misconstrue the current medical consensus and fail to reflect the realities of pediatric care and the needs of children and families." I'm always slightly uneasy talking about the trans issue because basically I think that there are advocates on each side who are very zealous, I would say, and there is a lot of evidence that seems to me to be mixed. To summarize very briefly, there's a British report last year that suggested that the medical route was not the best pathway for many adolescents who are troubled by these issues. And then you have the American Medical Association and that Pediatrics Association that we're talking about saying, no, it genuinely brings down things like suicidal ideation with people with gender dysmorphia issues. I would assume you would have a more firmly anti-view, but maybe you wouldn't.
Yeah, that's right. A lot of the studies that are relied upon by organizations like the AMA were very poorly designed, which is why the CAS review that you're referencing in Great Britain was so important. For example, one of the studies they use is actually a self-report study, and it included individuals who it would have been impossible for them to have received so-called gender-affirming care when they were minors because it either didn't exist then or they started transitioning after, but it's lumped into this giant study to suggest that they were better off after receiving gender-affirming care as a minor. It basically it refutes itself. That's one of the major ones, and there's a couple of others that unfortunately we don't have time to get fully into. But this is an extension of an executive order that Trump signed at the beginning of the administration that threatened to pull federal funding from hospitals that did provide, I call them sex changes for minor. I don't use the phrase gender-affirming care if I can help it because I think it's more of a euphemism than anything else. But I'm firmly in favor of this. I think this is a fantastic move. There was a review also done by the HHS over the summer where a variety of medical professionals reviewed basically all of the currently available studies and determined that the potential harms of these treatments, as they call them, do outweigh the potential benefits, and the better path forward is to focus on either behavioral therapy, talk therapy, etc. And it turned out that some of those people, they were originally anonymous. Some of them came forward and wrote an op-ed in the Washington Post that said, we are actually liberal. People were criticizing us. They accused Trump of basically handpicking people who would agree with his preferred conclusion. We were liberal. We went into this with an open mind and actually discovered that the evidence points against the widely accepted standard by the medical professional community in the United States. And so that's why we reached the conclusion that we did.
Let me get in very briefly, just in terms of where I see the difficulty for someone like myself who's slightly kind of moderate or in the middle in this issue. The Trump administration, on the one hand, wants people to report if hospitals are carrying out mastectomies on minors. You would need to convince me very hard that a mastectomy for a minor on those grounds was necessary. Now, whether people should report it or not is a different question. That's difficult to persuade me of. They're also trying to ban, though, breast-binding garments. is that really a long-term eternal wrongdoing? I mean, I find it very difficult to believe that that's causing people lifetime harm.
Yeah, I wish I could respond.
I know.
Unfortunately, we got to go.
Yeah.
All right, many Democrats are upset after the Democratic National Committee said it will not be releasing its extensive report detailing what went wrong in the 2024 election. Stick around.